And welcome back to GMA Health. I'm Rob Simmelcare. A recent study by the American Academy of Pediatrics found that a brief conversation with parents about early bottle weaning can have a tremendous outcome for children whose parents were educated by pediatricians during the 9-month checkup. In fact, those kids showed a 60% decrease in bottle use by the age of 2. Here with us to discuss the importance of early bottle weaning is Dr. Alana Levine. She's a spokesperson for the American Academy of Pediatrics and a contributor for babycenter.com. Doctor, thanks for joining us.
It's a pleasure.
So why is it so important to wean our kids off bottles by the age of, say, 18 months or 2 years?
Well, children who take the bottle for a prolonged period of time are definitely at increased risk of cavities in their mouth, especially if they're using that bottle to fall asleep at night. So it's very common that you warm up that bottle of milk, you get all cozy with your child, and you let them drink that bottle right before they go to bed or go down for a nap, and then you have that milk always bathing the teeth and causing cavities. Another problem is children who take the bottle for a long period of time tend to consume more milk. And if you consume a lot of milk, you're at risk for iron deficiency anemia as you grow up. So it's important to sort of limit the quantities of milk that your
Because
child
you're drinking
drinks.
too much milk and therefore you're not getting enough iron in other parts of your diet?
Exactly.
Okay, so what is the age? I have an 18-month-old. She's turning 18 months, 7 days after we do this. She still takes the bottle three times a day, so I'm guilty here.
Okay.
But what age should your child really be off the bottle by?
Ideally, I like to see my patients off the bottle around age a year, but certainly by 15 to 18 months. So you have those 7 days, time to jump in there.
Okay, so we're getting right on this as soon as I get out of here. Now, it's easy to talk about, but it's not always easy to do. Kids like the bottle. What is it that parents, why do they hesitate sometimes to get their kids off the bottle? Is it an emotional thing? Do they think their kids need it still?
Interesting question. I think that parents feel that their kids love the bottle so much and they just don't want to take that sort of security and that comfort away from them. I also think many parents are concerned about the amount of milk their children are consuming, and they're afraid that if they take away the bottle, they're not going to drink milk anymore.
But they actually don't need so much milk.
That's right. Really, as children get older and they transition from being infants when all they're drinking is breast milk or formula into toddlerhood, they actually don't need as much milk as they did previously. So if you can take away that bottle, give your child a cup, and have them take somewhere between 12 and 24 ounces of milk a day, that's really enough milk as far as I'm concerned.
Okay, so let's get to some tips on how to wean your little boy or girl off of this bottle. Your first tip is start early.
That's right.
How early?
Well, I tell my patients to actually start introducing a cup at 6 months, which seems super early because that's really around the time when you're just starting to feed them solid foods. But if you put that cup, fill it with either breast milk, formula, water, or whatever you want on their tray of their high chair, at first they're just going to play with it. But sometimes, usually around 9, 10 months, they'll pick it up and drink from it and sort of figure out how it works. And if they start doing it at that age, it'll make it a lot easier at around a year to actually transition from the bottle to the cup exclusively.
Okay, and there are a lot of different types of cups out there. You got the straw cups, you got the sippy cups, you got all kinds of different things. Is it good to try one particular kind or just experiment?
I actually recommend that parents buy one of each in the beginning. Some of the sippy cups have hard nipples, some have soft nipples, and different children respond to different things. Personally, I'm a big fan of the straw sippy cup, and that's for 2 reasons. One is that it's easy. If you go to a restaurant, you can just put a straw in a regular cup, and most restaurants will also have caps on the to-go cups, and then you're not lugging bottles around with you in your diaper bag. So that's one reason why I like the straw cups better. Another reason is it actually is harder for them to get the milk out. They have to suck with their mouth muscles, and it improves their speech when you use that cup.
Makes a lot of sense. Another tip, and this is a tough one, especially for a lot of new parents, be persistent and consistent with your kids about this. How do you do that?
Well, I think once you've decided that you're transitioning to the cup, take the bottles away. So you don't want to have a situation where one parent gives a bottle, or if your child is really begging for the bottle, you give it back to them. Once you've made the decision that your child's off the bottle, you really just have to be consistent with that message.
So the bottles are gone at that point.
Exactly.
Unless there's a true emergency of some kind, like she hasn't had anything in days. Yeah, exactly. Now, you mentioned if a kid gets a little bit older, maybe 2 years, something like that, you might be able to do something that actually makes getting rid of the bottle fun.
Yes.
I like this idea. Talk about that.
So once you get to age 2, at that point most children are speaking and demanding their bottles, but they're also able to reason a little bit. So what I say is throw a bottle party. So you get a big brown box, you invite friends and family members over, everybody takes a turn decorating the box, you make this beautiful box, you take all of the bottles, You put them all in the box, you seal it up, and you mail it off to the babies in the world. You're a big boy, you're a big girl, you don't need this anymore, the babies need it. And then that's it, they're out of the house, you had a fun party, a good excuse to get the family together. And,
a rite of passage.
That's right.
I love that. So, all right, so you've gotten your kid off the bottle now, and so they may be drinking somewhat less milk because of this.
Right.
Is there sort of a minimum? I mean, how much milk should they be drinking, or milk combined with other liquids, that kind of thing?
Well, the milk is a really good source of calcium and vitamin D. And so if your child is not drinking 24 ounces of milk a day, I would certainly recommend giving them calcium and vitamin D from other sources. One easy way to do it is with fortified orange juice. A lot of the orange juices now are fortified with calcium and vitamin D, so if you look for those specifically and your child likes to drink orange juice, that's a good way to get it in. But milk, cheese, yogurt, even ice cream, those are other sources. So as long as you combine what they're getting in the cup with what they're eating in their diet, you should be okay.
Lastly, you mentioned the risk of actually getting cavities and tooth decay from bottles. And this raises another question, which I'm curious about, brushing of teeth. I mean, if your kid, whether they're using the bottle or not, is taking some milk or something right before bedtime, should you be brushing their teeth using a cloth? At what age do you really need to start brushing?
Absolutely. It's really important to get that milk, juice, any sort of liquid, any food off their teeth. Once they have teeth, that's when I start recommending brushing. So if your child gets her first tooth at 6-8 months, then you can use a cloth, or they have these little rubber things that go over your finger, and you can sort of just get in the habit of rinsing the teeth off that way.
I've been bitten a few times by
exactly.
mine
You got to be careful. That's right.
So something with some protection
as they
would
get
be nice.
older, and you know, and around your child's age, that's the time that I would introduce a toothbrush. So what I usually tell parents to do to make it fun is give your child one toothbrush and you take one toothbrush, so that they get into the habit of doing it themselves, but they're not solely responsible for cleaning the teeth. They have toddler toothpaste that don't have fluoride, so they're safe to swallow, and you just really want to brush them. So if your child does like that last minute drink before going to bed or going down for a nap, I certainly would encourage parents to clean off their teeth before they go to sleep.
All right, out with the bottles, in with the toothbrushes.
Exactly.
This is a very important time. Dr. Levine, thank you very much for joining us. We appreciate it.
You bet. Thank you.
All right, and for more health tips that are good to know, you can always check out the health page at abcnews.com.